Psychopathology has to do with the study of mental disorders. I do not love the term mental disorders. I'm not going to kid you. I prefer the term psychological disorders, psychiatric disorders. For some reason, the term mental disorders is offensive to me. But it's the study of psychological disorders. To diagnose and treat them, it would be most important to study them to their fullest so we can really get a good understanding of them. Tell me how you think people with psychological disorders historically have been treated. People who are really struggling with something were often ignored. It feels terrible, absolutely. We ridicule them. Wasn't talked about at all. God forbid, you never want anyone to know. So when your family's struggling, you hide them. Punishment was a big thing. They were tortured, imprisoned, you were sent to asylums where you got no care. You were beyond invisible. You were them, not us. There was, back in the day, a really derogatory view on people who struggled with psychological disorders. We call that stigma. Okay? So there's this, There's this attitude towards it. Now, if I said, I have to go to cardiac rehab, is there that same, not at all? Okay, so yep, there's an element of stigma. There's an example. What else? The person's perception of you change, or does their behavior towards you change? I wouldn't want people's perception of me to change, so what would I probably never do? Share information. I would never let anyone know. Absolutely. Is it different? Why is it different? One has cancer and one has a mental health problem. Why do people think that it's internal? Like somehow it's a flaw of character if you can't get your shit together. Sometimes we could see them, can't measure them. It's all based on what? Self-report, report of others, and behavioral observations. We have no objective way of confirming or denying the presence of any of our disorders yet. Because since we can't objectively confirm it, it leaves a little bit of space for someone to go, really? You're that anxious you can't go to work? Really? Not quite 50% of Americans who at some point will be impacted by mental illness. And our society is still in the, really? And it was the first thing people say, that person must have been mentally ill. And so we have this link between danger, horror, terror sometimes, and mental illness. That is a unfair link. It's not cute, it's serious. Yeah. It's a condition that has treatment options available. So even the lingo that people choose, something's wrong with them. That impacts a person's perception. So the words we choose impacts another person's perception of that. Yep. And that's a problem. So the media doesn't help make it, like some kind of a horror show, or they romanticize it, which takes away the seriousness of it. Mental health issues are more prevalent than cancer. We're second to heart disease. So it's heart disease, mental health, cancer. Do you think people are cutting cancer research budgets? No. But they sure as hell are cutting mental health. So do we see that stigma even on a broader perspective? Yes. Just to give an opposite side of the coin, so while some kids are so they're so malleable. So in that classroom, if you had something different about you, total non-issue. So the parents, caretakers, teachers, anyone who is any kind of influence, it's kind of our responsibility to maybe suggest that there's other ways to see something. That's empathy training, and that's what we need, absolutely. Was there stigma then? Yes. Is there stigma now? Yes. It's just in a different way. I'd like to say we don't, but know that, the history of psychopathology is absolutely embarrassing and brutal. If you look on your outline there, you will see ways to define a psychological disorder. Those are just a couple of topics that are discussed in your book. I will say this. I had mentioned before, we do not have objective ways to measure or to confirm or deny the presence of a disorder right now. We don't have blood tests, we don't have brain scans, we don't have ways to measure someone's neurotransmitters. We don't have any of those ways right now. So the only way that we diagnose psychological disorders is through looking at someone's set of symptoms, and we use this thing called the DSM, which we're going to go over this throughout the entire semester. So we've got this set of guidelines. We look at someone's symptoms. But one of the other things is we look to see how the person's symptoms is impacting their regular everyday life. Okay? If I have so much anxiety that I actually can't walk into class and do my job, that anxiety is making me feel so uncomfortable that I can't walk into class. Do you see where that is personal distress? That's pretty extreme personal distress. Okay? So one of the things we look at is, does the person's set of symptoms create personal distress? Does it make them feel really uncomfortable? Since we are using the DSM-5 as our guideline, this is the book of all the disorders. We should have known that from intro. One of the things that you're going to see on almost every single set of diagnostic criteria is what we call SOF impairment. So SOF stands for social and or occupational functioning. So another way to describe someone's personal distress is to see if it creates what we call SOF impairment, social and or occupational functioning. Does this person's symptoms interfere with his or her interactions with others? Is it interfering with relationships? If the answer is yes, then we have SOF impairment. So social means with others. Whatever your job is, student, bus driver, accountant, working in retail, whatever it is, if the set of symptoms interferes with your ability to do your job, then that's what we call occupational functioning impairment. When we talk about SOF impairment, it's and or, social and or occupational functioning. It doesn't have to be both. It could be one or the other or both. If we're trying to decide whether or not someone has a psychological disorder, we're going to look at how much personal distress it's causing them. Another way we can say that is we're going to see if it creates SOF impairment. If so, we are far more likely to diagnose it as a disorder. Okay, so sadness in and of itself, not a disorder. If someone is so sad that they can't go to work, it may be a disorder. It may not, but it might be. Now, if someone's so sad they can't go to work because their best friend just died, well, it would make sense that they're so sad they can't go to work for a day or two. But if it's been a year and they're still so sad they can't go to work, kind of a different story. We try to decide whether or not someone's set of symptoms actually meets the criteria for a diagnosis. We look at personal distress, and we try to get a kind of step back and see how is this set of symptoms interfering with this person's regular everyday life. Also on the outline is disability. Does it interfere in a significant way with their ability to function? So during those episodes, does she have a significant amount of disability? Some textbooks look at whether or not the set of symptoms causes disability. Some people look at personal distress. Often the DSM is going to look at both of those. Violation of social norms. We've got to be careful with this one, because sometimes people violate social norms because they're making a statement. Sometimes people violate social norms because they just want to be different. And sometimes they violate social norms not because they're trying to, but because their mind is not able to reason very well. And so they might engage in behaviors that are really, really, really unusual because it's just a symptom of their psychological disorder. Violation of social norms, that could be an indication of a disorder, but not always. This is where you have to use some really good common sense. And then dysfunction. So oftentimes when we talk about dysfunction, that's a little bit of that's a tough term as well. As psychologists, psychiatrists, social workers, therapists, counselors, we are very concerned about a person's well-being. If someone is a danger to oneself or others, then that would obviously make us far more likely to diagnose that set of symptoms as a disorder. We have to look at kind of the whole picture and see, does this set of symptoms reasonable based on what's going on, or is the set of symptoms really interfering with a person's regular everyday life, potentially causing harm to oneself or others, potentially causing disability. So there's no hard, fast, here are the things that we know for sure will help us determine if it's a disorder. They're guidelines. And so a lot of clinical judgment is needed.